Hello, everybody, and welcome to another ICS podcast. My name is Shannon Wallace, and I am one of the members of the ICS Education Committee. I am so excited to start my annual podcast series on the workshops for ICS 2024. This year, ICS 2024 will be held in Madrid, Spain from October 23rd until October 25th. And we are really excited for the next couple months as we prepare for our annual meeting. I am so fortunate today to have Dr. Tufan Tarcan with me, who is going to be telling us a little bit about his workshop and his group's workshop. Their workshop is How Do Invasive Urodynamic Studies Affect My Clinical Decision in Non-neurogenic lower urinary tract dysfunction, a workshop of the ICS Urodynamics Committee based on interactive case discussions. So this workshop will be on Friday, October 25th, the last day, from 2 o'clock to 3:30 p.m. It is always a very busy workshop, so I encourage everybody to book their tickets as soon as possible. The chair of the workshop is with me today. I'm very lucky to have him take time out of his busy schedule to come and talk to me. So Dr. Tufan Tarcan is a professor of urology at the Marmara University School of Medicine in Istanbul and at the Koç University School of Medicine in Istanbul. And he's also the chair of the ICS Urodynamics Committee who are putting on this workshop today. So thank you so much for joining me and telling me a little bit about your workshop. Thank you so much.
Thank you, Shannon, for having me, and also thanks to the ICS for this opportunity. Yes, actually, you have very well said the title of the workshop, which is self-explanatory. It's very easy to understand from the title the aim of the workshop. This is a urodynamics committee workshop. We decided to organize this workshop because we know that there is still a big space to increase our knowledge on the best utilization of the urodynamic studies, especially in the field of non-neurogenic lower urinary tract dysfunction. Of course, we need to have a good urodynamic study before everything according to the ICS standards. Then, of course, we need to have a good knowledge on the pathophysiology and also the clinical evaluation of non-neurogenic lower urinary tract dysfunction. So the urodynamic studies are recommended according to many guidelines whenever they are going to change the decision making of for us in the management of our patients and also in the patient counseling, in the preoperative patient counseling. Well, this is a very broad spectrum statement, and many details are actually hidden behind this statement. So we are very happy for this opportunity to discuss with our members and the audience who will come to our workshop on the different types of lower urinary tract dysfunction in non-neurogenic origin, such as the female stress urinary incontinence, the female OAB, and female lower urinary tract symptoms. And also we will focus on the male LUTs, including post-prostatectomy incontinence, and actually try to increase our knowledge and share experience on this topic. I think the best value of our workshop is that we will devote almost the whole time of our workshop, which is 90 minutes, to the interactive case discussions, and we will do our best actually to keep the level of interactivity at the highest level.
Yeah, I mean, I think that is what is so great about this workshop and so novel is that there are a lot of, books on urodynamics and obviously a lot of, video presentations, and you can get some details. But I really think taking that knowledge and then applying that to actual clinical cases is how you make that step from understanding, what you're going to get out of a urodynamic study and then applying it to your actual patient. So this is a great workshop, I think, for kind of anybody who's really attending ICS. But from your perspective, like, who is your target audience? Who do you think is going to get the most out of this workshop?
Yeah, I agree. Actually, this workshop is for everybody, but we mainly aim here the functional urologist and the urogynecologist, who is also involved in the surgical management of the lower urinary tract dysfunction, because we will be trying to connect the findings of the urodynamic studies on how they are going to affect our especially surgical decision making in that patient group. And we will focus on real life cases. Everybody knows the discussion about the index patient, about defining the index patient, but in reality, the majority of our patients are complicated patients. So we will focus on real life cases and trying to link them, the urodynamics findings, to these especially surgical, but also medical and other types of treatments, decision making. So mainly functional urologists and urogynecologists, but also everybody who is involved in urodynamics, who wants to increase his or her knowledge on the urodynamic studies are welcome. Like physiotherapists, nurses, urodynamicists, basic scientists are welcome to our workshop.
Right. I agree. Right. Our nursing colleagues and physical therapists also take care of these patients, and many of the nurses perform these studies or interpret these studies as well and help to kind of guide decision making. So I think it really appeals to really a broad depth and breadth of our members at the ICS. And just tell me a little bit about the other speakers that are going to be involved in the workshop. Obviously, you're going to be leading the charge, but who else will be joining you?
Yeah, it's my great pleasure actually to announce the 3 speakers who will be with me during the workshop. They actually don't need any introduction because they are, worldwide known and well established scientists in this field. We will have Professor Carlos D'Ancona from Sao Paulo, Brazil. He served for many long years, almost at every position in ICS. And we are going to have Professor Maurizio Serrati, is a urogynecologist who is also the president of EUGA today. And we are going to also have, as the 3rd speaker, Mr. Chris Harding from Newcastle, United Kingdom, who is also now the chair of the EAU guidelines on non-neurogenic female LUTs. So it will be my great honor just to be with this distinguished faculty during the workshop.
A very global faculty,
yeah, very global and multidisciplinary
speakers.
Faculty, yeah.
Yeah, it sounds, this workshop obviously has the experts in the field from all disciplines that are coming to kind of, pack in as much information into this 90 minutes. So I really feel like it's going to be an extremely, very helpful and also really impactful workshop for many of our members. And kind of wrapping up and talking about the workshop, is there anything that you think is unique or different about this workshop than has been done in the past before, that you maybe, for people who've taken urodynamics workshops before and are thinking, I've had a couple before, and do I want to sign up for something new? Like, is there something different or a new perspective that you guys are going to be mentioning?
Yeah, I think, the highest value or the best value of this workshop will be its interactivity and also the utilization of real life cases. So we are not going to touch even a comma in the progress of our patients, and we will share not only our success but also our failures in that manner. So this is a real life workshop. I think this is the highest value of our workshop. I cannot say it is just unique to our workshop, but I think it's one of the values of our workshop.
I think that's a really great way to put it, is this is real world urodynamic experience. Yep. And of course, the index patients are really important. It's great to learn from kind of the bread and butter cases. But just like you said, once our patients come to see us and, they've been they probably had multiple different consultations with other people. Once they're coming into our office, they are a lot more complex with maybe a couple of different issues going on, and really being able to do a good urodynamics test and then being able to interpret it to tease out like what's your approach, either just like you said, medical, surgical, or conservative management, for this patient, and really optimize that is crucial. So I think you're right in that this workshop is very different to what maybe some of our ICS members have had in the past. And so I am sure it's going to be very well attended. I know that, it is one of the core curriculum workshops, which means that it is free to our members. So there will be lots of people who can sign up for it. But, if you want to make sure that you sign up soon, because there's only so much space that an auditorium can hold in Madrid. So for those of you who are interested, please sign up soon. And I just want to thank you so much, Dr. Tarcan, for coming and talking with me today and telling us a little bit about your workshop. We are really excited for it. And is there anything else that you'd like to say to the members or to me before we kind of wrap up our discussion here?
Well, thank you very much. Thank you, and to the Education Committee and also to the Scientific Committee for giving us this opportunity. Thank you very much, Shannon.
Thank you so much. And so just as a reminder, this workshop will be on October 25th, which is the Friday, from 2 to 3:30 p.m. And again, if you go online, it is how do invasive urodynamic studies affect my clinical decision-making in non-neurogenic lower urinary tract dysfunction. And this is a workshop of the ICS Urodynamic Committee, so really the experts in the field, and it's going to be based on interactive case discussions. So I want to thank everybody so much for joining in today and listening to us. Like I said before, we are very excited for ICS 2024 in Madrid, Spain, from October 23rd to October 25th. The registration is open, so you can go on and register, as well as start to sign up for the workshops. So thanks everybody for listening in, and I will see you soon, and we will see you soon in October.